Hello, my name is Professor Carrie, and I'll be showing you how to perform a blood pressure on an electronic device right here. So the first thing you want to do when you have an adult client is to wash your hands. Introduce yourself. I am Barry. I'm going to be doing your blood pressure today, and I'm going to provide you some privacy. So this information I'm going to collect today will just be between me and you. It's not going to be shareable. It's confidential. And so letting the person know about the procedure, I would like for you to place your arm, palm facing up, and just expose your arm. Roll up the sleeves. You are going to feel some pressure while doing this. I just want you to take some deep breaths. If you feel pressure, relax your arm on the table. This arrow right here should be on the brachial artery. Okay, the brachial artery follows your pinky finger. Put your palm up, right? So this pinky finger all the way up is where your brachial artery is. Okay? So you always want to align the arrow mark on the brachial artery. Okay? Relax your arm. Put your feet flat on the ground. Do not cross your feet. I'm not going to talk to you. I would like for you to relax, take some deep breaths. And the next thing I'll do is push the machine. My mistake. Okay, now it's on. The next thing I'll do is push the sign that says blood pressure. And I heard a beeping sound, which means I have a reading. So her blood pressure is 116/69. First thing I'll do is take it off. I feel comfortable. Okay, thank you very much.
You're welcome.
And then I'll wash my hands before recording the blood pressure. Okay? And that's the end of it. So her blood pressure is now recorded 116/69, and the pulse is 75. All right, thank you.